my formal background in medicine is I got boarded in internal medicine, practiced that for a few years, and then went into emergency medicine. But for the past 15 years or so, I've been primarily a physician executive, focusing on employee health and pandemic preparedness.
Great. And how has that role, especially focusing on employee health and pandemic preparedness? I know that your firm really focuses on wellness for employees at the point of work. How has that changed since the pandemic started?
Well, there's just been a change in the focus of priorities for employers. It's right now it's about protecting the employees' health from COVID-19. Yeah, it's going to be challenging, and people become complacent. That's just our nature. I think it's I don't see a mass closing of all the employer spaces again, but what I do see is that there's going to be outbreaks. And some of these outbreaks are going to be significant within communities and within certain areas like Houston right now or places in Florida. That that's going to keep on being bouncing around as to new places where you're going to be having endemic COVID-19. And in those areas where there's large outbreaks, the employers may push back, and it could be possible that in those regions go back to a more draconian type of situation where people are working from home again. I think real big challenge for the fall and the winter is that, especially the winter, is that we're going to have the flu season uh, start again, and then you're going to have up to maybe 5-10% of your workforce that has flu-like symptoms, and you're not going to know if they have a cold, if they have seasonal flu or COVID. So what I see the potential of employers doing more testing of their employees, just to determine what, if they're ill, what type of infection do they have? Do they have flu or do they have COVID or just a cold? In the workplace, it's pretty simple to say when you have a sick employee policy that if you're sick, don't come to work,
Mhm.
and when you're at sick, you're going to be asked to leave work. But the interesting things are when you start to take measures to prevent people from coming to work that are sick, such as the survey questions or the temperature checks. You have to go beyond that. So, for instance, let's say somebody, you have a thermographic scanner, it shows that they have a temperature, you don't allow them to come in, and you say, "Hey, go home and figure it out." The employer is probably going to have to do more than that because they could go home, come back the next day still with a fever, but they've taken 2 Tylenol and 2 Advil and they get in. So there
Mhm.
needs to be some type of process to manage these positives, whether it's through this, positives from the survey, temperature checks, or from testing. There needs to be some type of protocols for quarantine, and there needs to be some type of follow up with these patients to make sure they receive that medical care and they've been cleared to return to work. As far as the HR kind of benefits types of thing around sick leave, yeah, I mean that's there's a range of responses from employers. I was talking to a large food distributor, the largest food distributor in the United States, the other day, and they're struggling with how are they going to um, uh, manage sick leave for people, what type of requirements are going to be necessary. They have to see a physician to get some type of excuse, so now they are covered under this kind of sick leave policies that they're creating. The infectious disease community needs to get more involved with employers. I mean, they're the experts. They can provide practical, feet on the ground advice for folks. We were working with an infectious disease expert with a large group of food storage facilities that store about 30% of the perishables that go to grocery stores around the United States, and it was invaluable to have an infectious disease expert involved with that. I think employers in general are going to have to accept that now, whether they're in healthcare or not, if they're not in healthcare, they have to become a little bit of a healthcare company now. So some of the duty of care responsibilities they have are going to revolve around healthcare, and they need to be prepared uh, to manage those. And by leveraging a local infectious disease expert to support them, I think is really valuable.
That's a great point. Dr. Spero, thank you for coming on. Much appreciated.
Yeah, thank you. Take care.